Now, we all at some point in time have blamed ourselves for the food choices we make. For example, having that pack of chips with your bland dal chawal. Haven't we done that? But what a new series published in the British journal, the Lancet, has found is that this really is about a behavior anymore. It's not about our behavior or our choice. It's actually changed our palates. The shoving down ultra-processed engineered food items that are made and marketed and sold in such a way to get you hooked and addicted to it. It's being done by the big food companies, and that it needs to be called out and addressed by governments world over, because like in India and outside, our obesity and diabetes rates are only surging, and that's the reason why urgent regulation for the same is required. It's actually a series that has been published in the British journal, The Lancet. We delve deeper. Yet another alarm bell has been sounded. This time in the form of a series of reports published in the British journal, The Lancet. The report says our plates are changing. Our palates are changing as well. Traditional home-cooked meals are rapidly being replaced by ultra-processed foods, from chips to biscuits to instant noodles, sugary drinks and ready-to-eat packaged meals. And make no mistake, this is not about choice. It is about engineering and the hard push this kind of food item gets. The Lancet's 3-paper series, authored by 43 global experts, warns that ultra-processed foods are engineered for overconsumption, not nutrition.
If those diets in the high in ultra-processed food versus low, there is sufficient evidence to say it actually leads to displacement of the healthy diets, means your natural diets. So they are displaced. This is not going in addition to what you are eating now. This is going in place of, instead of what food you are eating if you are getting onto the ultra-processed diet.
The report says through aggressive marketing, celebrity endorsements, and promotional tactics, it drives the widespread consumption of ultra-processed food items. Retail shop shelves are now dominated by pre-packaged food and beverage products. So while making your choices, your food choices, and probably I shouldn't be even calling them food choices because these things really aren't food. You should be making a difference between what is processed and what is ultra-processed. Now, processed foods we all kind of consume. We consume butter, we consume bread, dahi in a packet. All of that is processed food because it's undergone some change to prolong its shelf life. Not saying it's good for you, but what really is terrible for your health is what is called ultra-processed foods. They're not even actually foods anymore. Your chips containing emulsifiers, the ingredient list which has certain names that you don't even identify or have heard of, they've been engineered in such a way to get you hooked to them. There's been a phenomenal rise for demands for ultra-processed foods in the market. It's been a steady climb across the US, UK, Canada, Spain, and also rising sharply in middle-income countries.
Even though the whole of India doesn't consume as America consumes, that the 50% of their diet is ultra-processed, we still don't have data in India to say so. What percentage of our diet is ultra-processed? That is what we are asking for, that the country needs to bring up data.
Between 2007 and 2022, ultra-processed food sales has jumped dramatically in low and middle income countries, and India is among the fastest growing market. India's ultra-processed explosion retail sales is $0.9 billion in 2006, nearly $38 billion in 2019, a 40-fold rise. Let's tell you also about the numbers as well, the numbers that should get us extremely worried. The obesity and diabetes numbers are startling in the country, and that really isn't an exaggerated statement. India is soon to become the obese capital of the world.
India is kind of on a cusp where absolute numbers are not high, but the rates of rise are very, very high. Now, considering we have a 1.4 billion vulnerable population, it becomes very, very important to halt this trend. Otherwise, we are going to have vast numbers of people with obesity and obesity-linked diseases such as diabetes, hypertension, joint diseases, so on and so forth, which also are linked to overall mortality, meaning death.
Experts say the problem isn't sugar, salt or fat. It is a degree of processing. The Lancet argues that improving diets cannot rely on consumer behavior. Instead, countries must urgently adopt system-wide policies, front-of-pack warning labels, banning ads during peak hours, restricting ultra-processed foods in schools and hospitals, and keeping corporate influence out of policy making. The message from the Lancet is clear. Regulations must be made and implemented because the longer ultra-processed foods dominate our plates, the higher the cost to our health.